This is Biernacki, and today I'm going over the top 13 things to shrink your bunions. So this thing right here, naturally, this stuff works. It's backed by medical studies, and we're gonna tell you about the big secret to tying it all together. And we're starting now. So the thing is, a bunion is like this. Your big toe joint is essentially bent over. Do I have a bunion? I don't. But as a foot and ankle doctor, I have done a ton of bunion surgeries. I see them all the time. And gradually, as my career has gone on, I've done a lot of things that can make the bunion both feel better and, basically people don't need as much surgery as I was doing early in my career. So in that way, can we cure bunions? I could say people don't want surgery as much by a significant margin with me. So I consider that fixing the problem. Are you ever as healthy as when you're a little baby? You're not. When we're little kids, we're the healthiest we're ever gonna be. That's kind of the bottom line. Are you gonna be perfectly healthy again? It's hard to guarantee that, but it's gonna be a whole lot better with the stuff I talk about here. Bunions are a big deal. They're not just cosmetic. They can cause you a lot of pain. I get it. I see so many tears, so many people in pain, and I know just how painful these things are. So there's a lot of shysters out there, a lot of surgery being pitched, a lot of fake remedies that don't work. So everything I talk about here is gonna be science-backed, and I'm gonna talk about whether it works or not for me, because this is something I deal with thousands of times, and I think we get a pretty decent result. But it's important what a bunion is. The thing is, there's 5 major causes of big toe joint pain, and a bunion is just one of them. So all of these are linked below, but bunions are a major cause. This is when the big toe joint or the 5th toe joint is bent. Hallux rigidus, this is osteoarthritis, generally after injury or older people. Turf toe, this is in athletes where the ligaments get strained, or those walking all day could even happen with. Gout. This is crystals that build up. You'll wake up one morning with a big red sore joint. And sesamoiditis. The sesamoid bones underneath the big toe joints can ache. Click below for all the videos on these specifics. And a lot of scammers out there will make you think it's possible to shrink it. You can reverse it. You can get it back into better position. But is it possible to reverse and shrink it in 1 or 2 easy steps? It's not. You got to do all these things, and you got to do it very well to get a good result. But they do work if you do these things practically. These things will alleviate your pain, reduce inflammation, and slow down the progression. If not, get the pain pretty much all the way away to make it feel better. And if you're in the Michigan area, come see us. We'd love to see you. So the number one important thing is patient education and self-management. You have to educate yourself on the cause, the risk factors, the prevention strategies. You have to understand what it really is. I have great guides below. Check those out. But if you're not treating the right thing, you will never have success. And that's the number one mistake I see people make. So starting with number 13, acupuncture. This is a traditional Chinese medicine technique that involves putting needles into specific sites. Some studies show that it can help with the inflammation in bunions. What this really does is it stimulates the area to stimulate some metabolic activity, but it's not really going to get to the root cause. It's not going to straighten out that big toe joint. That's why it's 13th on the list. But there are some studies, it's actually been well studied, that there are some benefits. So for example, the Journal of Acupuncture in 2014 did a study on big toe joint pain, and they found some results. It actually was a randomized controlled trial. So that's a very high level study, but this is gonna help with symptoms, not actually relieve the bunion deformity. Number 12, anti-inflammatory medications. This is your naproxens, your Aleve, your ibuprofens. These will help that swelling go down. So if your bunion is more swelling and aggravation, this will help it. And there are studies that show that it helps, but there's risks to this. This is not one of my favorite things. Even though it helps the pain, it's not a long-term strategy. So why keep doing it? Get to some of the better options. Number 11, cold therapy. So ice pads, ice packs, ice, putting it on there, the inflammation does decrease. It will help with your pain. This is a safe, easy one. And on that note, there's a lot of great creams like BioFreeze that can help. They kind of work like cold therapy. Heating pads, same thing. What ice does is it constricts the vessels, then shoots more blood flow in there, whereas heating pads kind of just warm it up. Number 10, anti-inflammatory supplements. So this is like the other previous methods, but this is herbal medications like curcumin, ginger, omega-3 fatty acids, some creams you could put on there. We have our list of our favorite natural supplements below that can help with your bunion pain. I won't get into the details here. Number 9, topical pain relievers. Topical medicine is more effective than the ones you take by mouth, and it's less dangerous. So these are creams like capsaicin, menthol, biofreeze. These can work really well. So if you have a business meeting and you have to wear high heels or a dress shoe, this can help quite a bit with a bunion. But again, it's not a long-term permanent solution. Number 8, yoga and other mind-body practices. We'll get into why this works, but essentially yoga can stretch your calf muscles, your foot muscles, your hamstring, your butt muscles. That takes a lot of pain off your bunion joint, and that improves your balance and flexibility. There was a study published in the International Journal of Yoga Therapy that 12 weeks of yoga intervention actually led to a lot of improvement with bunion pain. So this was a pretty good study with decent results. Number 7, massage therapy and shockwave. So I love shockwave therapy. If you're in the Michigan area, come see us. This can help with immediate pain relief in a lot of these cases, but massage as well. Massaging the ligaments in your foot, in your big toe joint. There's a lot of great machines and a lot of great devices that you can use at home. I link some of those below in our articles. This improves blood flow, your muscle function, flexibility. The International Journal of Massage and Bodywork in 2014 reported that manual therapy, including joint mobilization, significantly relieved the pain levels with bunion and actually improved the range of motion for bunions. So that's a great study. Number 6, toe spacers and bunion pads. I love these. I have a great video on those below. I won't get into the specifics, but getting some of these can really work. 2018, the journal Foot and Ankle Surgery found that toe spacers significantly can help with the alignment and reduce pain. This is a great tool to use with some of the other stuff I can talk about later in this video. And this was a systemic review and meta-analysis, so it's lots of studies. The toe spacers can give some benefit, but they don't correct it all by itself. Number 5, weight management. For the foot, 1 pound of body weight is 5 pounds less on your foot. That alone will significantly help your bunion pain. I have a lot of great diet videos if you're diabetic, if you're overweight, some great tricks down below that can make a big improvement. But in 2015, the Journal of Arthritis Care and Research found big toe joint pain specifically, losing just a little bit of weight can dramatically help your bunion pain. There's a lot of studies. I link some of them below. Number 4, exercises and physical therapy. So specific exercises and stretches specifically to your calf muscles, your knee, your hamstring, your glutes. It can help your feet. That takes a lot of pressure off the big toe joint. I link my favorite bunion workouts and stretches down below. This can strengthen and stretch the joints, and a physical therapist can help with this. So physical therapy for your feet, a lot of times I'd write a script. They can do a great job. I have some great partnerships with physical therapists locally. The Journal of Back and Musculoskeletal Rehabilitation 2017 found that physical therapy, massage exercises can significantly help your body alignment, so your hips, your knees, your feet, and the bunion. This is very well proven. If you do this properly, this should dramatically help your bunion. Number 3, taping and splinting. Using medical tape or a bunion splint to hold the proper alignment of your big toe can reduce the pressure of your bunion. And if you do this aggressively enough for long enough, theoretically, your bunion ligaments will get used to being straight. And I'm going to talk about this more a little bit in the future. You should get evaluated because there's more factors, and I'll talk about that. The Journal of American Podiatric Medical Association 2015 and even more studies found that non-surgical treatments like taping can really help. Using tape with the proper shoes, proper insoles, like I'll talk about, makes a huge, huge difference. Number 2, orthotic devices. Custom-made or over-the-counter ones can help redistribute the pressure of the foot and improve biomechanics and alleviate pain associated with bunions. There are a ton of studies. So in 2018, the Journal of Foot and Ankle Research found that when the big toe joint is in the proper position, the big toe moves properly, and if the big toe joint's in the proper position, it can hold the bunion in the proper function. So take a look at this orthotic. As I push down here, it's not collapsing. But if you get rid of that, look at how much it collapses. Look at that angle. See how the big toe bends? Gravity will make it bend over. But in the orthotic, as I push it down, it just moves straight up and down like this. So depending on where the back of your foot is, if it's flattened out or straight, that changes the angle, how your big toe lands. To me, it's such common sense, and with a proper insole, immediate results for patients. This is crazy to me that people with bunions would do surgery without making 100% sure that they have the proper orthotic. And this is what breaks my heart, is some people go into a surgeon and basically the surgeon's part of a surgery center where they get a lot of kickback, and they won't even try orthotics, they won't try a biomechanical exam, and they go straight to surgery and skip the orthotic. The orthotic for me almost always works. It relieves pain and it's completely safe, and it should be low cost. Some of my favorites are linked below, including specific videos on orthotic. And number one, proper footwear. There's a ton of great videos about minimally invasive shoes versus supportive shoes. They all can work great. But the bottom line is you want a shoe that can hold your heel straight, your knee straight, your calf straight, your hip straight, because that's really the key. How your foot lands is gonna be how the toe bends. Because the key is, if your foot lands straight, your big toe joint bends up and down. If your foot lands turned out, the big toe joint gets bent out this way. That's the whole trick. The big toe joint's like a bumper on the car, and you wanna make sure the brakes are working, you wanna make sure the engine's working. You can't blame the bumper for everything. And it's just the big toe. You want to have proper alignment through your feet, your knees, your hips. In 2011, the Journal of Foot and Ankle Surgery showed the proper shoes can significantly alleviate your foot function. I've seen lots of patients even turn it around, have straighter toes with absolutely no pain with the proper orthotics, proper shoes. Here's really the big secret. There's a lot of surgeons who are part of surgery centers. They can't really practically dispense orthotics or shoes, nor do they care to, because they make a lot less money. The hospital systems make a lot less money. If you go into an office where you're just booked straight for surgery without a proper biomechanical exam, if they don't check your feet, your range of motion, check your ankles, your knees, your hips, your calf, these are the people that have bunion horror stories. I see second opinions, third opinions. People have had 1, 2, 3 surgeries, and this stuff's never been checked. It's crazy to me. Start with this easy stuff. This stuff works really well. Check out all our bunion guides below, because guys, I care about you. I don't want you to be that patient coming from a second or a third opinion, because I know how much this can devastate people's lives if not done properly. But that being said, if all this stuff's assessed, surgeries should work great. 99.9% of the time, these surgeries work great as long as you take all those factors that I talked about into consideration. So check out those guides below.